Hello and welcome to Denver and the 182nd annual meeting of the Acoustical Society of America. I'm your host, Larry Frum, Senior Press Officer for the American Institute of Physics. You've missed two, well, maybe you did, I don't know. But we had two great press conferences earlier today, and we went from the depths of coral reefs to the landscape of Mars and everywhere in between. But we're not done yet. We've got some more exciting things to talk about today. And first off, degraded acoustic signals can make hearing difficult for anyone, but the differences in cognitive abilities, age-related changes, and the use of cochlear implants may exacerbate the problems. Kristina DeRoy Milvae from the University of Maryland says if it's more challenging to hear, it's also pretty exhausting to communicate. I've been doing it all day. Kristina, I've been trying to communicate all day, and I'm exhausted. I really am. But no, you talk about it.
Hey, that's understandable. I'm very excited to be here to talk to you today about aging effects on listening effort in cochlear implant users. And so this work is interested in answering the question, does age make speech understanding more difficult? And so that could be happening in multiple domains in terms of the percent correct that someone gets on understanding words or sentences. Also in terms of the effort or the cognitive or mental resources that are used to achieve that level of performance. And so my work is interested in looking at both of these domains, and particularly including effort as a domain of auditory perception. So listening effort is important to understand in cochlear implant users. So here's an image from the NIH website of a cochlear implant. It's an auditory prosthetic used in cases where a hearing aid is not functionally beneficial. And so cochlear implant users report effortful listening in noisy situations. And these devices provide highly degraded signals, which could result in listeners needing to exert even more effort. Pupil dilation in these experiments was used as an index of listening effort to examine how age and cognition might affect listening effort with cochlear implants. And so because I only have a few minutes, I'm going to jump into a summary of my findings. So in the first experiment, we looked at signal degradation and aging and found that listening effort increased with signal degradation, simulating cochlear implant listening for both younger and older adults with normal hearing. We also found increased listening effort with age for some levels of signal degradation. Our second experiment looked at memory load and cognitive abilities. We found that individual differences in working memory may predict increased listening effort with greater memory load for listeners with cochlear implants. And so these results show aging effects on listening effort, providing motivation for development of clinical practices to reduce listening effort in older adults with cochlear implants. And I just want to put up my acknowledgments, the students who helped collect the data in the studies that I described, as well as my funding, and the cochlear implant companies for their equipment support. So now I'm happy to take your questions.
Thank you, Kristina.
Yes.
I had a quick question.
Yes.
Is there anything that the users themselves can do to help, like use memory exercises or maybe just better equipment? I mean, is that what can maybe lessen the impact on exhaustion?
Right, that's a really good question. So I think there's different ways that we could go about trying to improve or reduce listening effort for this group. One would be, or for the users themselves, perhaps listening exercises could be helpful. That's something we need to look into and really validate, make sure we're using evidence-based practice. Yes, and I mean, it's something that we already do with cochlear implant users, is they do practice with their implants. But in terms of the listening effort, I'm not sure yet how much that impacts it. But also, things that could help would be advances in the technology. There's one more, and now I'm losing it. What's the other thing? Oh, and then as far as clinical recommendations. For example, in some patients, it could be helpful to have more than one implant, have 2 ears for additional benefits. So that's something I'm also looking into.
Okay.
Yeah.
We have questions from the floor.
Yeah. So why did you use pupil dilation as a proxy for listening effort, and like kind of how does that work?
That's a really good question. So it's an objective measure of listening effort. So pupil size changes. Pupil dilation is activated by the autonomic nervous system in general, and so we can look at the pupil dilation over time as they're listening to a sentence, for example, and then that gives us an idea of how, really, over time, they're deploying listening effort. Yeah.
Okay, thank you.
Mm-hmm.
And then how did you kind of look at and measure working memory for individuals?
Good question. So these are standard scores that we collected with an NIH toolbox measure of working memory. And so the listeners they'd hear a list of, I think, animals or foods, sometimes both, and then have to order them from smallest to biggest. So that was kind of the task there.
Okay, thank
Yeah.
you. And then one from our online listeners, is there a way to pair or integrate noise canceling technology to kind of improve the listening experience for these people?
Yeah, that's a really good question. So I don't think that anyone has really looked directly at how noise reduction in cochlear implants affects effort, but there have been studies in the hearing aid domain that do see reductions in listening effort with those noise reduction types of programs. So it's likely that it could play a role.
Were all of your subjects native English speakers listening to English, or did you try with other languages? Because I'm wondering if there's other languages that might be more consonant-based or vowel-based that are like easier or harder with effort for listening.
Yeah, great question. So yes, these were all English-speaking listeners listening to native English sentences. So I didn't look at different dialects or anything like that. But that could definitely be something that would affect listening effort. Those types of changes, yeah.
And one last one, do you have any future plans for studies along these lines, or what are you looking towards?
Yeah, so I really want to look more towards how having 2 ears might reduce listening effort in this population. So I've done some experiments with where these listeners are paying attention to one ear and ignoring the other. But I want to look at more realistic spatial configurations and see, does separating the target speech and the noise give a listening effort advantage?
Great, thank you. I think
Okay,
that's it.
thank you
over
so
here.
much.
Thank you, Kristina.
Yes.
Important information for those of us with older parents or just getting older. Thank you
Thank
so
you
much.
so much.
We'll be right back.